ready?
Joy O'Neill is living her dream. She runs a therapeutic equine riding center in Leeds, Alabama called the Red Barn. Volunteers at the Red Barn give horseback riding lessons to children and adults with varying disabilities. O'Neill describes the barn as giving folks who are hurting a place to come feel better. 2 years ago, O'Neill was hurting, feeling sick and struggling to get through the day.
I wasn't feeling like myself, and so I went to the doctor and told him I just didn't feel right. And of course, they did a bunch of tests and didn't really see anything. And just over time, every year, I would go and I would say, I don't feel right, I don't feel like myself, I'm gaining weight, I'm tired all the time, I'm having a hard time breathing.
She made repeated trips to the doctor, and her symptoms were always explained as menopause, stress, and even allergies. It wasn't until a routine physical for a life insurance policy that revealed an abnormal EKG reading.
Finally, I found out that I was in congestive heart failure. My ejection fraction was in the 30s, and anything under 40 is considered congestive heart failure. And they found out that it wasn't a blockage, and just did all of the tests and really didn't know what else to do, but I knew what to do, and that was to get to UAB as soon as I could.
O'Neill began seeing Dr. Salpi Pambukian, director of the UAB Women's Heart Health Clinic.
She is really a case study of what I'm talking about. So she had symptoms that were going on for a while. They were not the typical type of symptoms that many heart patients experience. She saw several providers. Unfortunately, they really weren't able to identify what was going on with her, but she persisted because she knew something was wrong.
Dr. Pambukian says that while men often have typical symptoms of heart disease, women's symptoms can be atypical and may include sweating, pressure, tiredness, nausea and indigestion, and even jaw pain, symptoms that are often mistaken for other issues.
I just kept pushing through thinking, you're just a weenie. This is what normal menopause is like. Look at your mother, your grandmother, your friends. All these other women have gone through this. Just quit your whining and move on. And I very easily could have been dead within just a matter of months.
The Women's Heart Health Clinic at UAB evaluates and manages patients while addressing the distinct concerns of women with heart disease.
Once women are identified to have heart disease, the treatments are very much the same. Of course, one of the main differences is hormone replacement therapy. So women who are undergoing menopause may require hormone replacement, and that can change your risk of cardiovascular disease.
Now that her disease is being managed properly, O'Neill is thankful to be back at the Red Barn doing what she loves. She sees herself not only as an advocate for children that come to the barn each week, but also for other women like herself.
The kids that we see here also have disabilities, and I just thought, well, what a great inspiration to follow my doctor's orders, to do exactly what she says, to become an advocate for women to be checked for heart disease.